Dr. Shahab, thank you for doing this. We're talking flu shots this morning. Just how important is it to get this year's flu shot?
Well, this is an annual ritual for many of us. I got mine on the first day when the clinic started, 14th of October. Since COVID, we offer the flu vaccine and the COVID vaccine every fall, and it's especially important for people at high risk, 65 and older, anyone 6 months and older with underlying health conditions, women who are pregnant. So I would strongly encourage anyone who is at high risk or lives with someone who is at high risk to consider getting the flu vaccine and, if appropriate, the COVID vaccine as well, as early as you can.
How bad is this year's strain of the flu? We've heard it's going to be quite vicious.
Well, the flu vaccine has 3 strains, and the World Health Organization monitors which strains are likely to go around in the southern hemisphere in our summer, that's Australia, and then what goes around in the northern hemisphere. I know there have been some reports about how well the vaccine will match the flu strain, but we can't make any of these predictions till we actually see influenza come, and how well the vaccine matches the flu strain that circulates, you can only tell after the season. So that doesn't really help you in making your decision. In any case, even when there's a poor match, the flu vaccine still significantly decreases your risk of serious illness and hospitalization. So irrespective of which strain ultimately becomes the predominant strain in Canada, it's still important to get your flu vaccine.
Dr. Shahab, what do you say to people like me who say, I get the flu shot, I get sick. Flu shot makes me sick. What do you say to people like that, like me?
Well, certainly, when I had both my vaccines, COVID and flu together, I did feel a bit achy for a couple of days, and that's expected. Sometimes you feel nothing. Sometimes, you may get an achiness in an arm or just an achiness generally for a day or two. But neither the flu vaccine or the COVID vaccine has any live virus. So that's just your body's immune response responding to the vaccine and making antibodies against the real virus, which is influenza or COVID. So, and certainly if you do get influenza, you are not really able to do much for a few days. If it's mild, you're off for 2 or 3 days. But if it's more severe, especially if you're older or frail or have underlying risk factors, it can lead to quite a serious illness.
Get this year's shot, Dr. Shahab.
I'm sorry?
Where can I get this year's shot if I'm interested?
Well, there's lots of places, like you can talk to your local pharmacy. You can go online to forflu.ca and see if there's walk-in clinics near where you live. You can book an appointment online. Some healthcare providers, some physician offices are also offering the flu vaccine. So lots of options available.
I think the only thing we missed in this conversation was your trademark cardigan. Dr. Shahab, thanks for doing this.
Thank you very much.